In this video, we're going to share Dr. Story, who do many murders, and at last he get caught by only one mistake. Before going in the depth of the video, please subscribe my channel and press the bell icon, and do not forget to share. Dr. Harold Shipman, one of the most prolific serial killers in history, was a trusted family doctor in England who murdered an estimated 250 to 500 patients over the course of more than 2 decades, although official estimates tend toward the lower number. Born in 1946 in Nottingham, Shipman grew up in a working-class family, and his mother's early death from cancer left a lasting impact on him. It is speculated that witnessing her suffering and subsequent relief through morphine injections influenced his later modus operandi. Shipman trained as a doctor and started his medical career in the 1970s. However, he was soon caught forging prescriptions for pethidine, a powerful painkiller, and briefly lost his license. Despite this early brush with the law, Shipman returned to practice and eventually established himself as a reputable and much-trusted general practitioner in the town of Hyde. Over time, Shipman began killing his patients, mostly elderly women, by administering lethal doses of diamorphine, medical-grade heroin, the same drug that had eased his mother's pain. To cover his tracks, Shipman would often falsify medical records to indicate that his victims were suffering from terminal illnesses or poor health conditions, making their sudden deaths seem natural. He even convinced families that no post-mortem examination was necessary, further concealing his crimes. Shipman's calm and professional demeanor allowed him to continue his killing spree unnoticed for years. However, his downfall came in 1998 when he made a critical mistake in his attempts to forge the will of one of his victims, 81-year-old Kathleen Grundy, a wealthy widow. Shipman had written himself into her will as the primary beneficiary, an act that immediately raised suspicions with Grundy's daughter, Angela Woodruff, a lawyer who knew her mother would never have made such a decision. Woodruff reported her concerns to the police, who exhumed Grundy's body and found evidence of diamorphine poisoning. As investigators delved deeper into Shipman's past, they uncovered a pattern of suspicious deaths, leading to his arrest. A subsequent investigation revealed that Shipman had killed hundreds of patients in a similar manner. At his trial in 2000, Shipman was convicted of 15 murders and sentenced to life imprisonment, though it was widely believed that his actual death toll was far higher. His motives remain unclear to this day, with some speculating that he was driven by a desire for control or a god complex, while others believe he was motivated by financial gain or personal gratification from manipulating life and death. Shipman never admitted to his crimes, and in 2004, he hanged himself in his prison cell, taking the full extent of his monstrous actions to the grave. His case led to significant changes in British medical practices, including more rigorous checks on death certification procedures and tighter controls over doctors' access to controlled substances. The Shipman case remains a chilling reminder of how easily trust can be manipulated by those in positions of power, and it continues to provoke debate over the proper regulation of the medical profession. If you liked the video, please subscribe our channel.